Thanks for coming in today. I'm really excited to meet you. But before we talk, I wanted to go over breast implants specifically, since we're going to be talking about that in person, and I want to really dedicate our time together to you and customizing this surgery to you. So here's a little bit of information about breast implants that I feel everybody should know and that will help you in making your decision when it comes to picking size, profile, and then the gel type that we're going to use if we decide to go on silicone. So the first thing is saline or silicone? That's the first question that I always get. And quite honestly, majority of my patients do choose silicone. I would say probably 99.9% of my patients go with that. However, if saline is what you're looking for, that's totally great, and we can work with that. The difference between saline and silicone is a silicone implant, like I'm holding here, is filled with a cohesive or gummy silicone gel, whereas a saline has the same outer shell but is filled with saline in the surgery. If you notice here, this is a smooth, round implant. I only use smooth, round implants. I do not currently use textured implants in my practice. And the reason for that is as you know, textured implants can be associated with anaplastic large cell lymphoma, or a very rare form of blood cancer. So I do not use that currently in my practice. That has not been found to be associated with smooth, round implants. When it comes to silicone implants, there are different types of gels. So we're gonna go over those gels, and as we talk about the look that you're going for, I can kind of help direct you and give you advice as to what gel may give you the look you're going for. Some women are looking for a more rounded upper breast pole, some are looking for a more natural slope, and so we'll discuss that together when we talk in person. But what I wanted to show is the differences in gels. There are actually different types of gels or gummy bear implants. And so if I hold this up, this is the most gummy or most cohesive implant. This is a Natrel SCF implant. And if you look here, what I mean is see how it's holding its shape pretty well when it's standing upright. Let's compare that to the least cohesive gel. See this? When I hold the same volume of implant upright like this, you can see the differences. And so this confers a more natural look to your upper breast, whereas the more firm implant, or more gummy implant, will take more rounded shape over time. So that's something really important that we should talk about during your consultation. The next thing is looking at the projection of the implant. The projection of the implant has to do with how tall this implant is, how high it's going to come off of your chest. And so this is a high profile. But if you look here, this is a little bit more extra projected implant. So different implants have different projection, and this will give a different look as well. So that's something that we'll talk about. I do measurement-based planning, meaning we're going to get measurements today. We're going to measure your chest diameter, all these things to help really customize the surgery to you. But we also want that implant to fit on your chest. We don't want an implant that's way wider than your breast can accommodate, because that will make you look top heavy or wide. So that's when we can adjust the height of the implant and the volume to give you the look you're going for. So I'm really excited to meet you. Again, I hope this information is helpful. The other thing I tell patients is that implants themselves are not permanent devices, meaning these should probably be exchanged within about 15 years of being placed. The FDA recommends after 5 years we get a high-resolution ultrasound or an MRI to check the quality and integrity of the shell, and then every 3 years after that. So again, these are not permanent devices. But with that being said, our goal is to have you enjoy your breast augmentation, and so we're here to help you. If you have any questions or any concerns ever, definitely reach out to us.